Hello everyone, I'm Dr. Kavya S. I'll be taking you through the 6 important articles of this month. The first article is transcorneal vitrectomy in eyes with regress retinoblastoma. The purpose of this study was to describe a transcorneal vitrectomy approach that avoids the use of chemotherapy or cryotherapy. It was a retrospective chart review that was performed on 5 consecutive patients with regress retinoblastoma for more than 12 months at Children's Hospital Los Angeles who had vitrectomy between November 2022 and December 2023. 5 patients underwent 8 vitrectomies for various indications, including intraocular lens fibrosis, vitreous hemorrhage, cataract, retinal detachment, and silicone oil removal. Neither chemotherapy nor cryotherapy was used. Wounds were sutures parallel to the limbus with 10-0 polygalactin suture, and a final water rinse was performed at the end of the surgery to lyse any potential retinoblastomas. Surgical objectives were achieved, vision remained stable, and no retinoblastoma spread was noted with a mean follow-up of 7.6 months. To conclude, this vitrectomy technique for eyes with regress retinoblastoma permits top-down viewing with the VRSI HD lens. Radial placement of corneal wounds avoids suturing through the uveal tract, and a post-surgical water rinse lyses any retinoblastomas. This approach may obviate the need of chemotherapeutics or cryotherapy. Coming to the second article, subretinal pigment epithelial hyperreflective spaces preceding large drusen collapse. The study was used to describe the hyperreflective subretinal pigment epithelial spaces in large drusen and drusenoid pigment epithelial detachment before collapse. It was a retrospective longitudinal study which enrolled patients with large and very large drusen caused by intermediate age-related macular degeneration. The following optical coherence tomography parameters were assessed: the drusen size, OCT biomarkers of RPE atrophy, presence of intraretinal and subretinal platelet, acquired vital form lesions, sub-RP regions of hyperreflectivity within the pigment epithelial detachment compartment. Of 50 eyes from 41 patients with large and very large drusen, 16 eyes progressive collapse. Eyes with sub-RP hyperreflective spaces were associated with greater drusen width and height than those without sub-RP hyperreflective spaces. At the collapse visit, eyes with sub-RP hyperreflective spaces displayed poor visual acuity and greater incomplete RP and outer retinal atrophy and complete RP and outer retinal atrophy length than eyes without sub-RP hyperreflective spaces. To conclude, sub-RP hyperreflective spaces are a novel optical coherence tomography findings of large and very large drusen that collapse to atrophy. Progressive RP dysfunction and failure may lead to reduced drusenoid material formation and progressive degenerative hydration of the large drusen before collapse, but this awaits confirmation with the HV analysis. Coming to the third article, in pneumatic retinopexy for giant retinal tear associated retinal detachment, a retrospective cohort study. The purpose of the study was to report the technique and long-term outcomes of patients with giant retinal tear associated retinal detachment treatment with pneumatic retinopexy. Coming to the methods, it was a retrospective cohort study. All patients presented with GRT-RD with tears in the superior 10 clock hours who underwent primary pneumatic retinopexy were included in the study. Coming to the results, 31 patients were included in this study. 61.2% achieved PAR with pneumatic retinopexy at 3 months and 58% at the final follow-up. Patients included in the study had a median follow-up of 24 months. The absence of retinal tear elsewhere at baseline was associated with the final PAR of 80%. 13 eyes required PPV after a failed pneumatic retinopexy. 2 eyes required intraoperative use of PFCL. No eyes required silicone oil. Visual acuity improved significantly from baseline to the last follow-up. Final anatomic reattachment rate was 100%. Coming to the conclusion, for selected cases of GRD, RDs affecting the superior 10 clock hours, pneumatic retinopexy could be a possible treatment option when patient comes into extra visits and the surgeon has substantial expertise. When lacking this extensive experience and comfort with the pneumatic retinopexy, PPP remains the treatment that is most likely to result in a primary anatomic reattachment. The next article is the evaluation of foveal hypoplasia in children with a history of retinopathy of prematurity. The purpose of the study was to evaluate foveal development in patients diagnosed with retinopathy of prematurity and to evaluate whether foveal development was affected by treatment in ROP patients. It was a cross-sectional study that included patients with history of ROP. Foveal development was compared between eyes with spontaneous regression and treated eyes. Additionally, gestational age, birth weight, ROP and zone and stage, and postmenstrual gestational age at the time of treatment were evaluated. The final visual acuity was analyzed according to the foveal hypoplasia severity. Coming to the results, this study included 166 eyes from 83 patients. Foveal development was significantly different among the treatment and spontaneous regression groups, and foveal hypoplasia was more severe in the treatment group. The prevalence of normal foveal development was higher in the spontaneous regression group than in the treatment group. This suggests that ROP treatment may induce morphological alterations during foveal development. Gestational age, postmenstrual age at the time of treatment, ROP stage, and ROP zone were considered with the foveal hypoplasia severity. Visual acuity was not affected by mild foveal hypoplasia, and 88.5% of the patients had a visual acuity of logMAR 0. Coming to the conclusion, early stage foveal development is not significantly restricted in patients with ROP, and patients with ROP show no significant visual disturbance associated with foveal hypoplasia. However, eyes treated for ROP either with laser photocoagulation or intravitreal antivascular endothelial growth factor demonstrated more severe hypoplasia compared to that with spontaneous regression. Coming to the next article. This was the article which compared the surgical outcomes of macular telangiectasia type 2 associated macular hole with idiopathic macular hole. The purpose of the study was to assess the longitudinal outcomes of macular telangiectasia type 2 macular hole and compare them with those of idiopathic macular hole. It was a retrospective single tertiary center study which included patients who underwent macular hole surgery between January 2015 and September 2023. Patients with characteristic OCT findings of mactal in both eyes or those who underwent fluorescence angiography were classified as having mactal macular hole. Baseline and postoperative best-corrected visual acuity and OCT parameters were reviewed. Coming to the results, totally 27 and 243 eyes with mactal and idiopathic macular hole respectively were included. Macular hole closure rate was better achieved in idiopathic than in mactal macular hole group at 2-year post-op. Temporary recovery of ellipsoid zone and external limiting membrane was more prominent in mactal than in idiopathic macular hole group. Statistically significant visual acuity improvement was seen between 3 months and 2 years postoperatively in mactal macular hole group. Coming to the conclusion, to the best of our knowledge, this is the first study to analyze the surgical outcome of mactal macular hole in both anatomical and functional aspects and compare them with patients with idiopathic macular hole. Postoperative microglia changes would have affected the restoration of outer retinal layer of patients. However, further studies are needed for clarification of the study findings. Coming to the next article. This article studied the safety and efficacy of intravitreal infliximab administered at the conclusion of pars plana vitrectomy in the treatment of proliferative vitreoretinopathy associated rheumatogenic retinal detachment. It was a randomized controlled phase 2 clinical trial. The subjects were patients with primary RRD and grade C PVR according to the updated Retina Society classification. It includes 66 patients which were randomized to undergo PPV and silicone oil injection with or without intravitreal injection of 1 mg per 0.05 ml of infliximab in the AFL globe before silicone oil injection at PPV conclusion. Surgeons were masked to treatment allocation until PPV conclusion. The mean outcome measure was anatomic success, defined as complete retinal reattachment without a tamponade at 6 months post silicone oil removal. Coming to the results, 60 eyes of 60 patients, 30 eyes in each group completed the study. For the outcome measures, 30 eyes in the infliximab group achieved anatomic success versus 29 eyes in the control group. The SOSR was higher in the infliximab group versus the control, but this was not statistically significant. Final logarithm of the minimum angle of resolution BCA was better in the infliximab group versus the control. There was no difference regarding IOP, IOI, time of SO removal, macula function, CMT, or VD. Coming to the conclusion, this study concluded that pars plana vitrectomy with silicone oil tamponade with or without intravitreal infliximab is effective in treating PVR-associated RRT. Infliximab may be associated with modest improvement in final visual outcomes but not anatomical outcomes. Thank you.